Hi, this is Amber Knowlton, and this is Unit 3 for Nursing 2212, Chapter 33 on hypertension. There's a direct relationship has been observed between hypertension and cardiovascular disease, along with a proportionate increase in the risk of myocardial infarction, heart failure, stroke, and renal disease with a higher blood pressure. 1 in 3 adults in the United States has high blood pressure. An additional 38% are at a high risk of developing hypertension. Hypertension or high blood pressure is an important medical and public health problem. There is a direct relationship between hypertension and cardiovascular disease. As blood pressure increases, so does the risk of MI, heart failure, stroke, and renal disease. 1 in 3 adults in the U.S. has hypertension. Additionally, 30% of adults have prehypertension, and approximately 8% have undiagnosed hypertension. Healthy People 2020 lists the number of adults with hypertension whose blood pressure is under control as one of the 26 high-priority leading health indicators for the coming decade. Blood pressure, the force exerted by the blood against the walls of the blood vessel, is primarily a function of cardiac output and systemic vascular resistance. Cardiac output is the total blood flow through the systemic or pulmonary circulation per minute. It is described as the stroke volume, or the amount of blood pumped out of the left ventricle per beat, multiplied by the heart rate for 1 minute. Systemic vascular resistance is the force opposing the movement of blood within the blood vessels. The radius of the small arteries and arterioles is the principal factor determining vascular resistance. A small change in the radius of the arterioles creates a major change in the systemic vascular resistance. If SVR is increased and cardiac output remains constant or increases, arterial blood pressure will increase. Blood pressure must be adequate to maintain tissue perfusion during activity and rest. The maintenance of normal blood pressure and tissue perfusion requires the integration of both systemic factors and local peripheral vascular effects. The mechanisms that regulate blood pressure can affect either cardiac output or SVR or both. Regulation of blood pressure is a complex process involving both short-term and long-term mechanisms. Short-term mechanisms, including the sympathetic nervous system and vascular endothelium, are active within a few seconds. Long-term mechanisms include renal and hormonal processes that regulate arterial resistance and blood volume. In a healthy person, these regulatory mechanisms function in response to the demands of the body. Each mechanism is more fully described in the following slides. This sympathetic nervous system, this nervous system which reacts within seconds after a drop in blood pressure, increases blood pressure by primarily activating the sympathetic nervous system. Increased sympathetic nervous system activity increases heart rate and cardiac contractility, produces widespread vasoconstriction and peripheral arteries, and promotes the release of renin from the kidneys. The net effect of SNS activation is to increase blood pressure by increasing both cardiac output and SVR. Baroreceptors, specialized nerve cells called baroreceptors, are located in the carotid arteries and the arch of the aorta. Baroreceptors have an important role in the maintenance of blood pressure stability during normal activities. They are sensitive to stretching, and when stimulated by an increase in blood pressure, send inhibitory impulses to the sympathetic vasomotor center. Inhibition of the SNS results in decreased heart rate, decreased force of contraction, and vasodilation in peripheral arteries. When a fall in blood pressure is sensed by the baroreceptors, the SNS is activated. The result is constriction of the peripheral arteries, increased heart rate, and increased contractility of the heart. In the presence of long-standing hypertension, the baroreceptors become adjusted to elevated levels of blood pressure and recognize this level as normal. Vascular endothelium is a single cell layer that lines the blood vessels. It produces several vasoactive substances and growth factors. Nitric oxide and prostacyclin help maintain low arterial tone, inhibit growth of the smooth muscle layer, and inhibit platelet aggregation. Endothelin is an extremely potent vasoconstrictor. The kidneys contribute to blood pressure regulation by controlling sodium excretion and extracellular fluid volume. Sodium retention results in water retention, which causes an increase in extracellular volume. This increases the venous return to the heart and the stroke volume. Together, they increase cardiac output and blood pressure. The renin-angiotensin-aldosterone system, RAAS, also plays an important role in blood pressure regulation. The kidney secretes renin in response to SNS stimulation, decreased blood flow through the kidneys, or decreased serum sodium concentration. Renin is an enzyme that converts angiotensinogen to angiotensin 1. Angiotensin converting enzyme converts angiotensin 1 into angiotensin 2, and that increases blood pressure. Prostaglandins secreted by the renal medulla have a vasodilated effect on the systemic circulation. This results in decreased systemic vascular resistance and lowering of blood pressure. Stimulation of the SNS results in release of epinephrine along with a small fraction of norepinephrine by the adrenal medulla. Epinephrine increases the cardiac output by increasing the heart rate and myocardial contractility. Epinephrine activates beta-2 adrenergic receptors and peripheral arteries of skeletal muscle, causing vasodilation. In peripheral arterioles, with only alpha adrenergic receptors, such as the skin and kidneys, epinephrine causes vasoconstriction. A2 stimulates the adrenal cortex to release aldosterone. Aldosterone stimulates the kidneys to retain sodium and water. This also will cause an increase in blood volume and cardiac output. An increased blood sodium and osmolarity level stimulates the release of ADH from the posterior pituitary gland. ADH increases the extracellular fluid volume by promoting the reabsorption of water in the distal and collecting tubules of the kidneys. The resulting increase in blood volume causes an increase in cardiac output and blood pressure.